My name is Sumeet Maniar, and I'm the CEO of WellBrain, and I'm here to speak about our digital health chronic pain management and behavioral health integration platform. Let me start out with the aspect that everyone knows about the opiate epidemic, but what is compounding that even further is the chronic pain situation, along with the behavioral health indications with chronic pain sufferers. Chronic pain is defined as 3 months or more, and this is impacting about 147 million adults in the US. The other aspect of the problem, as you've seen in slides with the other presentations, is the costs are compounded nearly 3 times as much for those patients with chronic pain and behavioral health situations. And those are to the tune of $65 billion extra that the insurance company and insurance industry is facing. So what is our solution? We are a digital health chronic pain and behavioral health integration platform where we enable providers and healthcare systems and other entities to choose from an array of evidence-based non-opiate modalities to treat chronic pain, fight the opiate epidemic, and help save lives. Specifically, we're an iPad app in the clinical situation. We're also telehealth enabled through the web. And then we have a smartphone solution where, based on outcomes, physicians provide customized results to the patients or customized prescriptions of our solutions to our patients, and then the physicians can track these activities accordingly. Overall, our solution is we started out as a point solution in providing customized, medically focused, in-house scripted mindful meditations, and then we expanded into these other services on neuromodulation, behavioral health integration, and now we have telepsychology and soon MSK, because there's no one size fit all. And this is driven by our physician focused input and what the patients want. So we're a true platform play here. Historically, WellBrain focused through our success with our distribution channel of working with providers across the country in the fee-for-service model. And recently, our current investment has come from the insurance industry, where we're going to help work with them using our success in that model, and then help move to more capitated plans and other types of managed risk plans. Our success with results of 2 sets of 3,000 patients each over a 6-month period to show consistency. And we saw clinical reductions in opiate prescriptions, emergency room visits, and then the subjective pain scores. So the patient improvement has increased. And if you extrapolate it out to various US statistics, these are significant impacts. Our revenue model is a software as a service for our physician aspect. And then we are moving upstream. We do have some smaller health systems, like smaller hospitals on our platform for pay as a software as a service. And then we also, because of our distribution model, we're a platform play. So we have platform access fees for some of the other solutions we've incorporated. And then ultimately, we're moving upstream into the larger per member per month subscriber models as well. The chronic pain market, the federal government really addresses a $500 billion, but if you really drill it down into our subsegments, this is the rough size of our market. And as for us, we're a early stage company. And so we're at about 22,000 MRR, climbing to, I think, 25,000 this month. We have 153 physicians across 33 clinics. And as I mentioned earlier, we are moving upstream accordingly. These are some of our commercial partners across the spectrum that are partner plays or institutional plays and or distribution plays. We've raised 2.1 million in the past, and currently we have our lead secured and funded for our current round. And we're asking for additional investment or relationships in any of those parameters listed below. Our team, we were co-founded by 3 practicing pain physicians. So we technically have 3 chief medical officers. And then collectively, we have access to about 30 to 40,000 of their patients as a living laboratory. And then I myself have founded several other startups, some with exits. And then the rest of the team has significant health and or digital health experience. So significant, maybe 70 to 100 years worth of experience. Here is our prototypical patient or successful patient who's better managed their life through the use of WellBrain with their physician. And we like to see more success stories like this. So I'll open it up for questions, and thank you for your time.
Thanks, Sumeet. Nice job. Congrats on securing a lead investor for your round. Why don't you tell us a little bit more about the round you're raising? What are the next steps in terms of use of capital?
Yeah, so the round right now we're raising is up to $4 million, and we have 2 investors already secured in this round and funded for that $1.1 million. And largely it comes, majority of that from the insurance industry. They see the potential. So the next phase is 2 things. We're focusing on growth on our existing revenue channels, and now we have the data points to do an actuarial-based cost-benefit analysis of some of the data, working with our physician networks, and provide effectively like the use of WellBrain with practices and the use of WellBrain without. And we'll be doing the study over the next 6 months and then presenting this data to like the Magellans and the Aetnas through our relationship with our investor. And then that will start the flywheel with respect to those. And then the other use of funds is we're enhancing the product. We are becoming largely, we can be easily a recommendation engine, meaning we could use deep learning techniques as we're seeing all the outcomes from the patients and all the behavior of physicians, how they administer the patients. So in the future, we can be a recommendation engine in the sense that, you know, woman age 35 with neck pain, most likely you'll see 88% success rate if you do A, B, and C. So we're kind of establishing a future standard of care, if you will, by just looking at how physicians operate across the country.
That's great. And you know, this is a relatively crowded space. Can you tell us where you fall on the competitive landscape and a little bit about your positioning in the market?
Yeah, I would say, you know, we were probably one of the first movers, and sometimes imitation is a form of flattery, but we're much more comprehensive in the sense that we're not really a mindfulness solution. We're more a comprehensive solution because this is a complicated situation to solve patient problems. So one of the unique thing is we do have a patent portfolio in the sense that based on these clinical validated scales that we help physicians track their patients longitudinally, we can provide customized guided recommendations based on some of those platform-based solutions, whether it's some physical therapy or some mindfulness. So that's helping us differentiate, but we're more all-inclusive. And then also through the robust use of behavioral health integration, we enable physicians to do many more activities with the patients. So we collect patient data while they're at home, and then there's subsequent follow-up. So that strengthens the physician-patient relationships. And then also that prevents any adverse events from happening. One quick example is a couple of physicians in the Houston area are using WellBrain as a barometer to monitor their patients to keep them in the guardrails of whatever prescriptions they have on them. So that's pretty unique. And then the patients are finding appreciative that there's more proactive reach out to them as opposed to just the doctor's office visit.
Great question in the Q&A from Esther. Sometimes algorithms tend to dismiss the problems of BIPOC or other patients. How do you make sure your algorithms are less biased than typical doctor or nurse?
Yeah, that's an interesting question. So we're incorporating additional deeper assessment surveys in the sense of looking at social determinants of health and incorporating some of that. So right now, what we've done is, interesting enough, we give the option because what has happened in these customized things, some patients want access to everything in the sense that they'll see, for example, mindfulness. We have different types of mindfulness: back pain, neck pain, and then PTSD and sleep and anxiety, depression. Sometimes a patient may have scored anxiety, but they say, hey, I want access to depression because I feel like using it. So a whole set of patients, or actually we leave it optional, and then we give them access to everything. And then we're kind of reverse learning. And then, so in some ways, it may not be 100% answering your question, but we're removing the bias that way because we're letting the market or the patients dictate what they want as well.